Hi everyone, my name is Lauren Wood, and today I will be going over an injury assessment using the disablement model. I am a Master's of Science in Athletic Training graduate student. To begin, the injury that I chose for one of my patients is an anterior shoulder dislocation. What is it? Is a shoulder dislocation occurs when the round ball at the top of your humerus leaves the socket in the shoulder blade or the scapula. That means that the ball and socket bones of the shoulder are separated with the ball of the humerus out of position. Something that can cause this is a fall or a blow to that shoulder, and then some signs and symptoms are immobility of the arm or difficulty moving it. The shoulder is visibly out of place, and there can be numbness, tingling, or weakness in the arm, hand, or fingers, bruising or redness, and finally swelling. Some body structures for this is the patient presents with a visibly deformed and out of place shoulder. This is an upper extremity injury, so it is swollen and it is presenting with discoloration, and the patient is unable to move the shoulder joint. The patient also presents with intense pain throughout the shoulder with something as little as touching the arm. This patient is present with a right anterior shoulder dislocation. Moving on, some activity limitations for this athlete is while the patient injured their shoulder while playing softball, she is a current college softball athlete. So something she should avoid doing is lifting heavy objects and playing sports that involve shoulder movement. Now for softball, that is almost every position and throughout the entire game. So she should avoid playing between anywhere 6 weeks and 3 months. Her participation level is fairly slim. She should remain in a sling for approximately 6 weeks. And then once that sling is off the patient, she can continue working out with her team, but she should only remain doing like isometric exercises. The patient can participate in AROM, PROM, and ROM. And she can also continue her education and any after school activities as long as she follows her rehab plan. Some environmental factors that contribute to this is that the patient would like to play softball with her teammates as well as continue her workouts. Also, the patient wants to be able to go out with her friends without having to worry about her shoulder limitations. And this was all discussed when her and I sat down and talked about her goals and concerns. These personal factors I found out when she filled out her HHQs and her PAR-QTs. The patient has had some previous minor injuries, but this is the first upper extremity injury she has experienced. This patient is 20 years old and she does have a family history of arthritis. The patient has some experience seeing orthopedic specialists, but not for her upper extremities. And also the patient does not smoke or drink. For a treatment plan, I put a question mark after surgery because this is specific to the type of shoulder injury, and it is complex and challenging when determining if surgery is necessary or not. Regardless, the primary goal is to establish a stable, pain-free shoulder with active range of motion. So if this becomes surgical, there are outside variables that contribute to this. This can include, but it's not limited to, age, occupation, functional demands, if the patient participates in sports or not, and then the physical characteristics. This is a closed reduction case, so there is a period of immobilization and then physical therapy to strengthen that rotator cuff and those scapular stabilizers. Ways to prevent this is to wear protective gear when you play contact sports. Now, softball is not necessarily a contact sport, but there is some contact involved. To avoid bracing your falls when you are going to make a dive or a catch. And then to exercise regularly to maintain that strength and flexibility in all the joints and the muscles. Some risk factors are included as shoulder stress, like the repeated shoulder stress. You may be at risk if you are participating in a sport with repetitive head movements, and this can cause your shoulder to weaken or stretch or tear over time. With softball, you are very prone to that. There are some traumatic events, and this is mostly relates to athletes who are constantly in contact sports. And then finally, genetics. People can be prone to a lot of laxity in their ligaments, which at the end of the day could prevent them, could not prevent them with the proper support they need in their body. To conclude from this model, athletic trainers can use clinical outcomes to further treat a patient while also examining the quality of healthcare the patient is given. These models help create foundations for evidence-based practice for other healthcare professionals while they treat their patients with similar injuries. Thanks so much, guys. I really hope you learned a lot from anterior shoulder dislocations today. Bye.